This video is to help you understand the surgery and recovery from thyroidectomy. Your doctor may recommend a thyroidectomy for a variety of reasons, including large nodules, cancer, or uncertainty about what might be happening with your gland. We do thyroidectomies on a fairly regular basis, and they are safe and commonly done. We generally recommend an overnight stay in the hospital if you're having your entire gland removed, but if just half of your gland is planned for removal, then you would go home the same day, which is called an outpatient surgery. There are some risks associated with thyroidectomy that are worth discussing. The first is hoarseness. There are nerves that move your vocal cords that run behind the thyroid gland, and they are responsible for a normal voice. If you have injury to one of these nerves, you may have a temporary or permanent weakness. Temporary weaknesses are much more common and run in about 10% of patients who have their thyroid gland removed. Permanent weaknesses are closer to 1%. If there's a permanent weakness, there are additional procedures that may be done to improve the voice. The next complication that can occur with thyroidectomy is low parathyroid function. The parathyroid glands sit adjacent to the thyroid gland and are responsible for your body's calcium regulation. Parathyroid glands are generally left intact in place as the thyroid gland is removed, but they can become stunned due to disruption of their blood supply. Some patients will require additional calcium and vitamin D supplementation for a temporary basis until the parathyroid gland function returns to normal. This includes approximately 25% of people who have an entire thyroid gland removed and is usually a temporary situation. Finally, the risk of a seroma or hematoma, which is a collection of fluid or blood under the skin, can occur. And for this, we often place a drain for the first day or two. Infection is a rare complication. Thankfully, the blood supply to the neck is robust, and so we rarely see this, but it is a risk. Finally, what do you expect after thyroidectomy? When can you go back to work? It depends a little bit on what you do. If you work in an office with little physical activity, you may be able to return to work in a few days. If you have a more physically intensive job, generally your doctor will recommend at least a week recovery time to reduce any possible risks. Generally speaking, we recommend staying off of aspirin and other blood thinners for a week, along with limiting physical activity to less than 30 pounds of lifting and no heavy physical activity during that week. If you have any additional questions or concerns regarding thyroidectomy, please feel free to contact your doctor's nurse, and we look forward to seeing you again.